Hi everyone, in this module we're going to discuss the reproductive option of IVF with PGT. My name is Lauren Isley. I am a certified genetic counselor, meaning I have a master's degree in genetic counseling. And for the last 10 years or so, I have specialized in assisted reproductive technologies and infertility. So what is preimplantation genetic testing? The acronym for this is PGT, so you'll hear this technology referred to as PGT moving forward. This is a genetic test that's performed on embryos to look for the presence and absence of specific genetic variants, or often known as mutations. There are actually a number of different forms of PGT. So the first form of PGT is PGT-M, and the letter M stands for monogenic diseases, meaning genetic conditions that are caused by a specific genetic variant in a gene. And PGT-M tests embryos for single gene conditions, and this does include X-linked conditions. So for the purpose of this discussion today, PGT-M is probably going to be the most relevant type of PGT to you. There's also PGT-A, and A stands for aneuploidy, and this tests embryos for extra or missing chromosomes. However, it also examines the X and the Y chromosomes, so it effectively can determine the sex of an embryo as well. Notably, PGT, any form of PGT, does require in vitro fertilization, or IVF. And IVF basically is used to create the embryos that will be tested. So how does in vitro fertilization, or IVF, work? So this is essentially the process in which eggs and sperm are combined in an embryology laboratory to create embryos. Once that happens, one or more embryos are then transferred to a woman's uterus to achieve a pregnancy. Now, the success rate of IVF is extremely variable, and it depends on a number of different factors. That includes a woman's age, and the underlying fertility issues, both on the male and the female side, and then other factors as well. So generally, IVF involves a number of different steps. The first being induction of ovulation. So the female patient would receive medication or various hormones, and that helps to stimulate the ovaries to release multiple eggs. The woman then undergoes an egg retrieval procedure, which essentially collects these follicles from the woman, which contain the eggs. And those are collected in a procedure where the woman is under a light anesthesia. After that, fertilization is the next step. This occurs in the laboratory, where a sperm sample from either the partner or a sperm donor is added to the eggs. And we hope that the sperm penetrates those eggs, and then those cells start dividing and they create an embryo. And then once that embryo has grown and divided for several days, then the embryo transfer occurs. And that's when one or sometimes multiple embryos are placed into the uterine cavity through the cervix. PGT-M would occur after that fertilization step, but before embryo transfer. And sometimes embryos are actually frozen once they are fertilized and biopsied for the sample, and then they are thawed prior to embryo transfer. So why and when would a carrier for an X-linked condition pursue this option? So PGT-M can be used to significantly reduce the risk of conceiving a child who would be affected with that particular condition, or in some cases just be a carrier of a genetic condition. Just note that PGT-M is only possible if the specific genetic variant or mutation is known within that patient or within that family, meaning prior genetic testing on that patient undergoing IVF with PGT is necessary. So some aspects to consider with IVF and PGT. Just know that PGTM is considered a screening test. It is not 100% accurate. That is because we're only testing a small group of cells from the embryo. So we have a very small sample size to work with, and that can sometimes compromise the accuracy of the test. And laboratories will quote varying accuracy rates depending on the specific variant and the specific protocol they need to use. And they will generally recommend that a person undergoing IVF with PGTM would pursue prenatal genetic testing when they are pregnant to confirm those results. Know that IVF does require the use of certain fertility medications, as well as the egg retrieval procedure, which in general can carry a risk for medical complications in various ways. PGTM requires a customized test to be created. And this can sometimes take several months and may require DNA samples from multiple family members. So there are certainly some logistics to consider. So in terms of financial considerations, the average cost of one IVF cycle is $10,000 to $20,000 and often more than that as well. And many patients require multiple IVF cycles depending on their family building goals. Although this is not included on the slide, there is an additional cost to PGTM on top of the IVF that can be several $1,000s as well. Many insurance plans sadly do not cover the cost of IVF. However, there are definitely some exceptions, and insurance coverage for fertility treatments is certainly improving overall. Just know that a nonprofit family building organization called Resolve does have a list of infertility financing programs and services that can help pay for some of these reproductive medical treatments. So if this is a concern to you and your family, it's something to look into. And then next steps, if this is an option you're interested in, have you undergone a confirmatory genetic testing to determine what your specific genetic variant is? If not, I would encourage you to meet with a genetic counselor or another trained genetic specialist to help coordinate that genetic testing on yourself. If you already have undergone genetic testing, the next step would really be to consult with a local fertility specialist who does perform both IVF and PGTM at their clinic. And then it is also strongly recommended you meet with a genetic counselor either at the fertility clinic or at the clinic's PGTM laboratory, or even both ideally, to discuss the process in detail. Thank you.